Hi, my name is William Xu, and on behalf of my collaborators and co-authors from the Department of Surgery at the University of Auckland, I'd like to welcome you to this video abstract of our paper titled Local and Regional Analgesia Following Colorectal Resection, a Network Meta-Analysis. Postoperative pain is common after colorectal surgery, and systemic opioid analgesia delivered by a patient-controlled analgesic pump has traditionally been the mainstay of treatment. However, this is not without its problems because systemic opioids have unpleasant side effects and have been shown to delay gut recovery. Current enhanced recovery after surgery guidelines recommend that a multimodal opiate-sparing approach to postoperative pain management is taken. Many different local and regional analgesia techniques currently exist to help contribute to this multimodal strategy, and some of these include epidural analgesia, spinal blocks, transverse abdominis plane blocks, intraperitoneal local anesthetic installation, intravenous lidocaine infusions, among others. However, it remains unclear which of these is the best. Our aim, hence, was to investigate which local and regional analgesia techniques were the most effective for reducing postoperative pain and opiate use after colorectal resection. We conducted a systematic literature search of Medline, Embase, and Central, and included randomized control trials investigating local or regional analgesic techniques in adult patients undergoing colorectal resection. And we excluded papers which compared either different formulations of medication delivered by the same route, or papers comparing variations of the same local or regional anesthetic technique. The main outcomes of interest were postoperative pain and opiate consumption at 24 hours. We conducted a network meta-analysis using a Bayesian statistical approach with a non-informative prior. 74 RCTs with 5,101 patients were included in this network meta-analysis. We included 11 different analgesic techniques shown here in this network geometry map. Each node here corresponds to a different intervention, and each line represents a trial comparison between the two. We also stratified patients into groups who had open surgery or minimally invasive surgery alone. In addition, we identified patients who were cared for exclusively under ERAS guidelines. Overall, we found that spinal analgesia and transverse abdominis plane blocks struck the best balance between reducing postoperative pain and opiate consumption at 24 hours. The main conclusions of the study were that spinal analgesia and tap blocks appear to be the best interventions for reducing pain and opiate use in the immediate postoperative period. Other interventions such as intraperitoneal local anesthetic installation also showed promise for reducing pain. However, it remains important to tailor the analgesic strategies to the individual patients at hand. Thank you for taking the time to view this video abstract.